regional. And I will be discussing today with you PRN medications and their importance in your client's medication administration regimen, as well as an emphasis in pain management and GI management. So first, PRN, what it stands for is pro rata, as a thing is needed. So as needed medications. And like I said, they're an important part of your client's medication routine. They'll be ordered for a variety of conditions, and each medication order needs to have specific parameters indicated in order for you to administer the medication. And here's just a quick overview of medication administration in general. You're going to want to follow the 7 rights of medication administration with your PRNs, the same as you would your standard medications. First, you want to ensure you have the right person. This can be asking the client to tell you their name and date of birth and verify that against the the medication administration record, or MAR. If a client is not able to tell you their name or date of birth, some other identifier needs to be used. I've seen previously used a photograph that is attached to the MAR that you can hold up against the person you're giving medications to, just to make sure you are giving it, in fact, to the right person. You want to double check that you have the right medication. So you're going to be comparing the medication on your MAR to whatever you're dispensing the medication from. Same thing for the right dose. Make sure the dosing matches the MAR. If the order is, say, for Tylenol for 650 milligrams and you have 325 milligram tabs, making sure that you're giving 2 tabs. So you want to make sure those doses match up. Make sure you're giving it at the right time, whether it's a morning medication, evening medication, twice a day. You'll make sure you want to follow that. Make sure it's the right route, since there are many routes that we can give medications: topically, orally. We can give medications through inhalations. So you just want to make sure that you're giving it the right way. You also want to make sure you're giving it for the right reason. If you're giving a medication for hypertension, blood pressure control, you want to make sure your client actually does need that medication for blood pressure control. And then the right documentation, which is a very important part that sometimes gets missed. You want to make sure you're documenting whether the medication was given, refused, or held, just to make sure that you're communicating with the staff who are coming on after that a medication was administered or attempted to be administered. This is really important because it'll help prevent double dosing or just complications with your client due to not getting medications. And another thing I didn't add on here, make sure you verify your client's allergies. Allergies are sometimes not recorded on a MAR. You want to make sure that if a client doesn't have any allergies, that no known allergies is written somewhere on that MAR, just that way you're acknowledging that you do know that this client does not have any allergies. And if they do have allergies, when you go to a client's medical appointment, make sure that you are letting the doctor know what their allergies are. So in the event that a new medication is prescribed, nothing's prescribed that's going to cause complications. And then you'll want to follow your 3 checks for medication administration by reviewing the MAR when you're preparing the medication and also while you're administrating. So what makes a PRN order different? And that's the parameters for administration. Here's an example order for Miss Jane Doe for 3 milligrams of melatonin orally at bedtime as needed for insomnia. And in this instance, the doctor ordered that you could repeat the dosing 1 time after 30 minutes if the first dose is not effective. So I have a little exercise for you, and you can unmute yourself for this exercise or type in the chat box. I am going to give a medication order, and I would like for you to mention what part of that order is missing. So this first order is for Docusate, 100 milligrams BID or twice a day as needed for no bowel movement times 2 days or more. Unfortunately, I can't see the chat box, so I don't know if you got it right or not, but the route, you want to make sure that you are giving the medication as the doctor wants it to be prescribed. Generally, Docusate or Colace is going to be administered orally, but it is one of those medications that can also be administered rectally. So you do want to clarify with the provider how the medication is to be administered. If it looks like this on your MAR and you're able to look back as to a printed order, sometimes it'll be found there. Often a pharmacist should be catching these errors and inquiring themselves to the prescriber. However, with over-the-counter medications, if it's being filled with an over-the-counter bottle, the pharmacist isn't going to be there to catch that. So you would want to just call the provider's office and verify how they want it administered. So here's the next order for Ativan 1 milligram orally as needed for anxiety. And frequency, that is the bit that's missing. The reason why this is super important is you want to make sure you're not giving a medication too frequently, which could cause an overdose, and especially in some medications can be extremely dangerous for the clients. And here's one more. It's for 650 milligrams of Tylenol orally every 4 to 6 hours as needed. All right, and the reason or parameter is missing from this one. So you're going to want to clarify what is it ordered for? Is it ordered for pain? Is it ordered for fever? And generally when it's ordered for pain, it'll say, you know, pain on a scale of 1 to 10 or 4 to 6. Or if it's for fever, it could be for fever greater than 101, or whichever the doctor wants you to administer for. All right, so for PRN administration, when do you want to give it? So obviously, if your client asks for a PRN medication that they're in need of, that would be a good time to give. Something that's frequently missed is if there's an observed need. A lot of our clients are unable to request medications, whether it's because they don't know what's available to them, or maybe they don't have the capacity to recognize that they're needing medication to help with any of their symptoms. So it's important to pay attention to how your clients are behaving. If they're normally pretty outgoing and active, and all of a sudden they're not really wanting to participate, or they're withdrawn, or they're agitated, you can try and ask some probative questions. Like if someone looks like they're holding their belly, you can ask them if they're having belly pain, and just kind of try and pinpoint what might be going on. And if it sounds like maybe they're constipated, ask them if they'd like a stool softener, or if they're having pain, ask them if they'd like some pain medication, just to kind of help prevent any complications further down the road. Another thing, and then what to consider before giving a medication, is there anything else you can try first? So sometimes if someone's having pain that is related to, positional, we can try changing position. We can try using heat pads if that is indicated. We can encourage people to get up and walk around if they're constipated. It helps wake up the GI tract. So any of those things that we can try before medications are often a good idea. Another thing to consider is whether or not enough time has elapsed between doses of medications. So if someone asks for Ativan because they're having anxiety, you want to make sure that enough time has passed since the last time it was given before you give another dose, to make sure you don't over sedate somebody. And that's one of the reasons why it's very important to document when you give a medication. And then the other portion to consider is whether the condition of the client meets the order, or meets the specifications of the order. If, say, a client's having trouble falling asleep, and they are requesting Ativan. You wouldn't give Ativan for sleep unless the order is for sleep. If the order is for anxiety, you wouldn't write down that you're giving Ativan for sleep. You would write down that you're giving Ativan for anxiety. And it could be anxiety related to sleep or not being able to sleep, but you want to make sure that the reason you're giving the medication is matching what is on the order. And here's just an example of what documentation of a PRN medication would look like. Make sure that you indicate the date and time that the medication was administered, what medication was given and how much and how. So for this example, it was the Tylenol 650 milligrams by mouth. And then for the reasons. So this client asked for the Tylenol because she was having a headache that she rated 5 out of 10 on the pain scale. Especially when you're giving a PRN, you want to be as specific for why you're giving it as possible. In theory, you could write pain, 5 out of 10, but it's better to list where the pain is. So that way, if there is a trend, you can look back on your PRN log and say, hey, this person's been having like a headache every day for the last 2 weeks. And even if we can't figure out why there's the headache for the last 2 weeks, that'd be something important to bring up to the provider. And then you can bring a copy of your PRN administration log to let the provider know, hey, this is what's going on with this client. And then the next part of PRN administration that's incredibly important is documenting the results. Did that medication administration work? In this case, the client was rechecked in 45 minutes and reported her headache had subsided to a rating of 2 out of 10. She said that was totally fine with her, and that's where it ends. However, if the client's saying, hey, the headache's still pretty bad, I'm miserable, you would want to look and see if there's anything else you can give this client for their headache. And, sometimes people have headaches because they're dehydrated or they're having caffeine withdrawals. In that case, you'd want to make sure you're getting them hydrated. I mean, if they're dehydrated, make sure they're getting some fluids. But if you don't have medications additional that will help with the headache or whatever the client is complaining of, that's when you're going to want to seek medical care, whether it's going to urgent care or going to the ER or following up the provider. You'll want to make sure that you do follow up and try to get the client some relief, and then also document what your follow-up is. And then here's a little bit more about the reassessment and just making sure you're documenting the results and the time of your reassessment, making sure that you document it in the same format of your administration. So if you use a numerical pain scale for documenting when you administer the medication, you'd still want to use a numerical pain scale when you're documenting the reassessment. And then, as I said, if there's no change, you would put no change, and then what other method of treatment you tried. So I kind of want to go over a little bit of different types of PRN medications. The more common ones that we see are the psychotropic medications, respiratory medications, pain relievers, and then GI medications, but there are so many others. One that I didn't include on the slide, but that I do want to bring up is when a client has an allergy that could result in anaphylaxis, you want to make sure that their provider has ordered an EpiPen or some sort of epinephrine rescue medication, and make sure that you know how to use that. We just want to make sure that our clients are safe in that regard. And it would be important to know how to administer an EpiPen prior to needing to, so familiarize yourself with how that medication is administered. And in the case of anaphylaxis, you would want to call 911 immediately after administering, or having someone else call 911 while you're administering the medication. So a little bit about psychotropic medications. There are different classifications: the antipsychotics like your Seroquel, the anxiolytics like Ativan, and then there's the sedatives and hypnotics. For an example, Ambien The thing that I want to highlight with the psychotropic medications is that they do have the potential for significant side effects that you want to be paying attention to in your clients. And that could be drowsiness, dizziness, dried mouth, blurred vision, nausea, constipation, sleep disturbances like sleepwalking, and muscle nervous system complications. So if you're seeing any unexplained movements or involuntary movements that are new or worsening for your client, that is definitely something that you want to let the provider know about as soon as possible. And for respiratory medications, there are several types of as-needed medications. The first two are pretty common with our clients who have significant chronic lung issues, and those are your inhalers and nebulizers. A common medication that is given in both those routes is albuterol. I don't know why I'm trying to say Ativan. Some other medications that you might see ordered as needed for clients for respiratory symptoms are decongestants such as Sudafed, expectorants such as guaifenesin, and that medication helps thin mucus secretion, so it's easier to move through the respiratory system. And then also your cough suppressants like Robitussin, Vicks. So now I'd like to go over pain management, which is a common issue with our clients. There are two types of pain. There's acute pain and chronic pain. Acute pain is any pain that is less than 6 months, and it should go away after the underlying cause is resolved. So say someone broke their toe, that is going to be incredibly painful, but we would hope that by the time that the toe has healed, the pain has gone away. As opposed to chronic pain, which it lasts greater than 6 months, it can be either constant or intermittent. So someone could be in pain all day long, or they chronic, like say they have like a soft tissue tear that's like happened 5 years ago and they just never healed right. It could be after extensive movement throughout the day that is where their pain is, but in the morning they might not be complaining of pain at all. And it's generally related to underlying medical conditions or a result of lifestyle habits. And here's just a visualization of the pain scale, which you all might be familiar with. It's generally posted at every physician's office. So the three most common scales are the numerical scale, the FACES scale, and the verbal scale. So your numerical scale is pain on a level of from 0 to 10, 10 being the worst pain, 0 being no pain. The FACES scale is a really good tool to use for your clients who are not able to tell you verbally what their pain level is. You can tell kind of what someone's pain level is by looking whether they're grimacing, whether they're shifting uncomfortably in their chairs, or if they're withdrawing. Those can be signs that they're having pain. And for some people, they're not able to use like a numerical quantifier for what their pain level is, but they can tell you, they're having the worst pain of their life, or they're mildly in pain, and you can use that pain scale as well. So there are different types of PRN pain medications. The first group that I want to talk about are the anti-inflammatories, and those are your NSAIDs and your steroids. Typically, steroids aren't used as a PRN. They're generally used as a scheduled medication, but in some cases, like the dexamethasone, it can be used for short-term as needed, and it should work within about start working in about 30 minutes. But that one, you do get the best relief if you're using it as prescribed, not as a PRN, but as a scheduled medication. But sometimes you'll see it as a PRN. And then your NSAIDs are your non-steroidal anti-inflammatories like ibuprofen. And one thing I do want to mention about the steroids, if you have a client who is taking steroids and they're taking them long-term, they tend to have issues with blood sugars. If they're already diabetic, that's something you'd want to be aware of, or there can be weight gain. And then I want to go over the analgesics. So there's two classifications, the opioids and the non-opioids. So your opioids are like the morphine or Norco, or it's totally skipped my mind. But so the medications with the opioids are considered analgesic for pain. Something to be very considerate of is these medications can be very sedating, especially to the respiratory system. So if you have a client who takes narcotic or opioid pain medication for pain relief, make sure that you have Narcan available in the home or wherever it's being administered, just because there is always a potential for overdose. I believe Narcan is now something you can buy over the counter at the pharmacy, or you can have the physician prescribe it. You can talk to either physician or a pharmacist about having or getting Narcan for your clients. And then there's the non-opioids like Tylenol or acetaminophen. And something to consider with the Tylenol is to not give more than 4 grams within 24 hours, because it can be toxic to the liver. But a provider may say that to not exceed a lower amount if someone has already got liver issues or kidney issues. Let's see. I think that's about what I wanted to cover with the pain medications. And again, just wanted to reemphasize, if your client is showing symptoms of pain, don't wait to give medication until they ask for it. You can ask them, hey, you look like you're uncomfortable. Are you needing pain medication? And just ask those probative questions. And if it's someone who's not able to tell you explicitly what their pain is, you can go off of their body cues. All right, so now I want to talk a little bit about GI management. This is a pretty complex system, as you can see from the diagram. Common issues that we see when it comes to GI management are GERD, which is gastroesophageal reflux disease, nausea, vomiting, diarrhea, and constipation. So for GERD, what happens is the stomach contents repeatedly backflow into the esophagus due to like that gastroesophageal sphincter not working appropriately. And it does affect roughly 14% of the adult population. The PRN treatments that you'll probably see are like Mylanta, Tums, calcium, which is also calcium carbonate, Tagamet, or Pepcid AC. Let me see sorry, I lost my spot there for a moment. Symptoms that you might see with someone who has GERD are complaints of heartburn, and that's pain from mid-chest about the sternum up through the throat. It can be a sour taste in the mouth. There can be some regurgitation, complaints of nausea, burping, bloating, dry cough with repeated clearing, sore throat, hoarseness, or laryngitis, and it tends to get worse when you're lying down. What's important to know about GERD is that it isn't a benign medical problem. There can be significant complications if GERD is not appropriately treated. So it's important to make sure that they're adhering, or your clients are adhering to their the standing GERD treatment, such as like they're taking Prilosec on a daily basis. But some of the things that can happen if GERD is not properly managed are esophagitis, which is inflammation of the esophagus, which can be very painful, make it very painful to swallow. It can also lead to GI bleeding, and sometimes that can result in what is called coffee ground emesis. So you want to make sure that if you're seeing any of that, definitely take them to the hospital, get them checked out. Could lead to esophageal ulcers, so breakdown of the tissues in the esophagus. Can also result in esophageal stricture, so that's narrowing of the esophagus, which will make it more difficult for your client to swallow, which puts them at an increased risk for aspiration of stomach contents or even like food that they're eating. One of the big problems with aspiration is the development of aspiration pneumonia, which is actually one of the leading causes of death in our clients. So we really want to make sure that we are avoiding that as all costs. It can also lead to a condition called Barrett's esophagus, which is the changing of the tissues in the lining of the esophagus, which it can actually lead to cancer. So those are definitely things that we want to avoid. So if you have a client who is repeatedly having discomfort that appears to be from GERD, offering them, any of their PRN medications. Hey, do you need a Tums? Do you need some Mylanta? And if that medication isn't helping relieve their symptoms, you'd want to make sure you take them to a provider to be assessed. And some management for GERD. What can be beneficial for your clients is instead of having 3 large meals a day, you want to have more frequent, smaller meals, decrease the amount of fatty and acidic foods that are in the diet, decrease alcohol consumption, preferably stop all alcohol consumption. And some foods that are unfortunately can exacerbate GERD are chocolate, peppermint, and coffee. So you'd also want to reduce or remove those from the diet as well. Weight loss will also help decrease the severity of GERD symptoms because there's not that abdominal weight pushing on the stomach, pushing contents back up into the esophagus. Also, smoking cessation will help reduce symptoms of GERD and reduce tight-fitting clothing.
Hey, Katie, I know you don't have the chat box open, but Beth had a question about GERD and teeth issues.
Yes, enamel erosion is also a big issue when it comes to GERD. So definitely want to make sure your dental care is managed. I did write that down. I just skipped right over it. Was there a specific question regarding?
No, she just said, what about teeth issues?
Yes, definitely. Dental decay is definitely an issue with GERD. So diarrhea, not much fun for anyone. Common symptoms are abdominal pain, cramping, evidenced by watery stools. Complications that you can see with diarrhea are dehydration, which can become serious if not treated appropriately. That could eventually lead to kidney injury or UTI. And then skin breakdown is also an issue just because of the frequent stooling is really rough on the skin. So if you have a client who has issues with diarrhea, like chronic diarrhea, you'll want to make sure that they have some sort of topical agent or cream, like a barrier cream that has ordered from their provider to help protect that skin. There are also PRN medications that a provider might order if someone has diarrhea, and it's like Imodium or Lamodal, which helps slow down the digestive tract, gives the body a chance to absorb some of that water in the intestine to firm up the stools. However, if a client has a condition such as C. diff, a doctor will not prescribe those medications because we want to try and flush that bacteria out of the colon. So we don't want to, in that case, they don't want to stop that. They'll just make sure that we control the dehydration by making sure clients are getting enough fluids. And then nausea, vomiting, generally treatment is fairly short term. If someone has nausea, vomiting that is not resolving within a short time or shorter time frame, definitely follow up with your providers. But medications that you might see ordered as needed for nausea or vomiting are Zofran, Phenergan, Dramamine, or Compazine. Out of the 4 of those, Zofran is the only one that isn't going to be sedating. The rest of them actually can cause significant sedating, especially if used frequently. So that is just something to be cognizant of. Long-term nausea, vomiting, if not managed, can lead to malnutrition and dehydration. So and on top of giving antiemetics such as Zofran, you're going to want to make sure your clients are getting enough fluids as well. All right. And something that doesn't seem like a big issue, but is a very, very big issue is constipation. Common causes of constipation are lack of exercise, not getting enough oral fluids, poor dietary habits. Medication is also a big issue, especially with our clients who take a lot of different medications that all interact with each other differently, can lead to constipation. Our psychotropic medications tend to cause constipation, but one of the biggest causes of constipation when it comes to medication are your opioids like Norco or morphine. If you have a client who's taking any opioid medications, it's important to make sure that they are getting, they have a standing order for bowel care, such as Colace, or at least have a PRN available. And then some conditions or diagnoses that your client may have that could lead to constipation or chronic constipation are IBS, hypothyroidism, people that have been diagnosed with autism spectrum disorder are also at a greater risk for constipation. Clients with diabetes and clients with nerve damage also can have issues with constipation. And then this is not a complete list. There are many other conditions and diagnoses that can lead to constipation, but those are some of the more common ones. So indicators of constipation. If you have a client who's complaining of rectal bleeding, that could be a sign, especially if it's bright red, that could be a sign of constipation. Abdominal pain or cramping, vomiting, loss of appetite, the inability to pass gas, and a frequent urge to use the bathroom, but not being able to produce a stool. Clients who report using their fingers to remove stool or to splint the area around their anus in order to get stool out, that is definitely a sign that there's an issue. Bloating, feeling like they're not able to have a complete bowel movement, or straining. So if you're seeing any of those symptoms in your client, it is possible that they are having issues with constipation, and that would be a good time to have either a conversation with them about how they're feeling, ask them if they, about taking a stool softener or a laxative if that's ordered for them. If they don't have anything ordered, that would be a time to talk to their provider or take them in to be assessed. So for non-pharmacological interventions, for clients who are constipated or have chronic constipation, you'll want to make sure that you increase their fluid intake, or encourage them to increase their fluid intake. Make changes to diet, and that includes increasing fiber. Increasing fruits and vegetables will really help increase the fiber, make it easier to pass a stool. Increasing physical activity where you're able to will also help wake up the GI system and get the bowels moving. And consuming foods containing prebiotics and probiotics, such as yogurts with blood cultures or fermented foods such as sauerkraut and kimchi, are beneficial to helping with stooling. Another intervention that I have seen work wonders is warmed prune juice with about a tablespoon of butter melted into it. Not something you want to use if your clients are diabetic, but something about warmed prune juice and butter can work miracles for someone who is constipated. And then for your pharmacological interventions, that would be laxatives, such as senna, or stool softeners such as Colace. And then in like extreme situations, you'll see enemas, but likely not something you will be dealing with, but that is just one of the other PRNs that are prescribed for constipation. So the complications from unresolved constipation can be pretty severe. Not only can it cause significant pain to our clients, it can cause significant health complications. Hemorrhoids can be incredibly unpleasant, and it can also result in repeat bleeding, anal fissures, which are break down the skin of the anus. It can cause pelvic floor damage. It can result in a bowel obstruction if not resolved promptly. It can also cause bowel dilation. So that is when the circumference of the bowel increases due to the increased amount of stool that's not being able to pass, which can result in megacolon, which has the potential to become a life-threatening crisis. It can also result in bowel infection or bowel perforation, which are also emergency sorts of situations, can result in rectal bleeding and rectal prolapse. Another thing to consider, especially with the bowel obstruction client, or a client who ends up with a bowel obstruction, that can sometimes result in the need for a surgeon to place an ostomy, which is when stool is redirected through an opening in the abdomen instead of through the anus. And that is a major life-changing surgery. Sometimes it could be temporary and they can do a takedown a couple months later. Sometimes it ends up being permanent, and that's just something to consider in regards to clients with constipation. It could, unresolved constipation could result in surgical interventions, which can, change the course of their life, as they could end up needing to be moved to another home. And if there isn't another home in the area that would be able to take care of a client with an ostomy, it might end up having to move counties, which means they could lose the opportunities to go to programs that they're familiar with. So we just want to avoid these complications if at all possible. One way you can keep track of client bowel movements is using a bowel log. And the reason for this is it helps you communicate with other people on the team what the bowel or your client's bowel schedule looks like. It helps you identify what's normal for them, what's not normal for them, and that will help you identify when something is wrong and when to get help, or when to give a PRN medication, such as a stool softener. It can potentially reduce client discomfort from constipation and reduce potential injury. And if your client is having repeated issues with their bowel schedule, this would also be a good document to take a copy to their provider for. And this is the fancy nurse's chart that everybody loves. It's called the Bristol stool chart. You can learn a lot about what your client needs from the consistency of their stool. There are lots of different diagrams that are available. This diagram could be beneficial for clients who are not able to verbalize what their stool looks like if they're independent enough to be able to use the bathroom on their own, but not able to tell you exactly what their stool looks like. They could use a chart like this to, show what their stool is looking like, so you can mark it on a bowel movement log. It can tell you, if they need more fluids, if they're needing less fluids, if they're needing more fiber. Very important thing to keep track of. And I guess I'm ending a little bit earlier than I thought. I was speaking way faster than I used to, or I had planned on. But in summary, it's important to know your client's PRNs. When giving a medication at a scheduled time, such as your morning medication pass, look over what PRNs are available for your clients. If they have pain medication available, you can ask your client, hey, are you having any pain this morning? Do you need a pain medication? And like I said, ask clients about their health conditions. If you know your client has GERD, or you know your client has issues with their bowel movements, ask them about them. Ask them, hey, when was the last time you had a bowel movement? How, was it easy to pass, difficult to pass? Did you have to strain? And if they're indicating that they do have a issue, offer a PRN. And then another aspect to remember is know your clients. We're lucky enough to work in a way that we get to see our clients on a daily basis or near daily basis. So we get a chance to know them pretty well. So you are one of the few people who are going to know when something's off with your client. If something doesn't seem right, you can try asking questions, try and figure it out. And even if you can't figure out, that you can get help for your clients. If something just doesn't feel right, trust your gut, ask your physician or ask their physician, take them to urgent care. The worst that can happen is that they tell you that there's nothing wrong and just to come back if things don't get better. But yeah, definitely trust your gut when it comes to your clients. Document your PRN administration as well as the reassessment. And then if your PRN medications are not effectively treating the symptoms for your clients, seek medical attention. And does anyone have any questions or comments or anything that I didn't go over that you would like to know about?
Hello.
Hi.
Hey, I had just started with a client that we have to record her BM. And I was wondering if you could put up the stool chart again and I can screenshot that. I think that would help me.
Sure. Let me see. I think. There we go.
Awesome. Thank you so much.
No problem.
So Katie, since we have some time left, are there any other areas, health areas that we commonly see PRNs ordered for?
You put me on the spot and now I can't think of it off the top of my head.
I think the one that comes to mind for me, and I know you talked about psychotropics, but is agitation.
Yes.
And irritability, which, I guess, I think most people can relate to this as caregivers. When people are agitated, one of the last things they do is ask for someone to give them a pill for it, right? If anything, sometimes they get offended that you've offered. So I don't know, do you have any advice for our providers on how they can kind of decide, or interpret a person's behaviors as them needing a PRN for that?
I would suggest trying to figure out the cause for the agitation or irritability. I know that when I'm having pain or I'm uncomfortable, I can become more agitated. If you can try and see if maybe something along those lines, like if someone's having a significant amount of pain, you can ask them, hey, are you having some pain? Not necessarily jumping straight to a psychological cause for their behaviors. And I mean, sometimes we end up offending people no matter our best intentions. Yeah, is that kind of what you were asking about, Jen?
Yeah, I think that there's a lot of situations where folks might be having severe behaviors, and sometimes those psychotropic meds are ordered for behavior management as opposed to for a psychiatric illness. And so I think it can be difficult if anyone is depending on the individual to ask for something in that moment. So it's important that that you know what is on your client's MAR, on their PRN sheet. I know it's a busy work day, and you guys are primarily looking at the meds that they have to take and passing those at the right time. But it's not uncommon for DSPs to not really know what options they have as PRNs or what they're for. So it's important that you kind of already are familiar with what's available, you know, what's in your toolbox there, so that when the situation arises, whether it's constipation, nausea, or, you know, agitation, not being able to fall asleep, so that you already kind of have an idea of what the options are that you can offer to them. So it does take a little bit of research, you know, taking the time to look through those MARs on the PRN pages so that you know what you have available. I wonder, does anybody have any questions about PRN use, and or maybe any stories or pointers that you can give to the rest of the attendees today? Carrie, I see your comment in the chat box. It says sometimes you get unverbal clients, and you have to be very aware of your consumer and why they're acting the way they are, or how they feel and what they need. And you are absolutely right, Carrie. It's you know, it's also really important, I think, that you're familiar with the client and really know what their normal behaviors are, and also what their negative behaviors are, right? So that you know and can identify, because maybe in the past, you know that when they act a certain way or start having a certain behavior, like maybe picking at themselves, or you know, rocking back and forth, and not wanting to make eye contact, or maybe you're aware that that they've got something that they can be given that will help with that symptom. But I think it's difficult sometimes when we have staff turnover and or new people who don't know the clients very well. So it would be nice, I think, to have like care plans in place that go into more detail about, you know, what does agitation look like for this person? And, you know, what does insomnia look like? What's their behavior when they're feeling sick to their stomach, or when they're having constipation? Because it may be not anything similar to what you or I do when we may be having those struggles, right? So having a way of communicating those things to new people who are coming in, or covering, like at a certain, you know, maybe they work at one house, but they're going to go help out and take a shift at another house where they're not familiar with the clients. Just having those types of things written out, I think, can be really useful. And even maybe putting something on the MAR that, you know, maybe the doctor's order says, you know, lorazepam 1 milligram PO, PRN anxiety. But maybe putting a little notation of what anxiety looks like for that person, so that the staff who are actually reading the MAR can say, oh, okay, now I see what anxiety is, because anxiety is one of those things that's very different for everybody.
And if you're not sure, you can always reach out to other people on the team who may be more familiar with the client and just be like, hey, I'm seeing this behavior and I don't know what it means. Are you familiar with this? And sometimes you can get some really good information that way as well.
Hey, Ryan, I see your question. I can definitely send your certificate to your Bravo address. But we don't send out our PowerPoints. But as a reminder, all of our classes are on the Far Northern Regional Center YouTube channel. They have the date and the title on there, so you should be able to easily go through and find whichever topic you'd like to watch. It does take a couple weeks to get it loaded up there, right? So like this class today, it'll be a couple weeks probably before it's online. But I know that we have all of our videos through January of this year on our YouTube channel, and I highly encourage you guys to share that with your coworkers so that they can go ahead and watch it at a later time when they're available. I know it's hard for everybody to get together at the same time on a Wednesday afternoon, but definitely go check out our Far Northern YouTube channel. There's other classes and stuff on there too that you might find really interesting.
I just had thought of a question or a scenario that actually happened a few months ago with me.
All right,
Go
for it.
It was okay. So the PRN OTC said that the client can have ibuprofen, but then there was also the doctor's note in there that said that we had to get the physician's permission before giving them the ibuprofen. So everybody was kind of like,
That'd be very confusing.
Yeah.
Yeah, I would definitely reach out to the doctor and be like, hey, what do you mean?
Yeah.
And in cases like that, it could be the client has some kidney issues and the doctor wants to make sure that the labs are still looking good before giving, because it can cause further kidney damage for individuals who already have kidney issues. So there may be a reason behind it that it's not explicit. But yeah, that would definitely be a situation. Just even like preemptively reach out to the provider before you even need to give the medication and find out, hey, is this a medication you do want us to give eventually? Or, can we get an order? And if they want it to be like he really wants to be notified every time it's given, I would make sure that that's written down, and hopefully they would give you a reason why.
Definitely. Yeah, it was just like it was really nice. I worked the knock shift, so it was really late, and we ended up just finding another solution that he was okay with and doing. But yeah,
knocks are hard when that happens. It's like, I don't want to call a doctor at 2:00 in the morning.
Yeah. But okay, yeah, that helps. Thank you.
All right, well, I think if there are no more questions, we'll go ahead and wrap it up for today. Big thank you to Katie for presenting today. Thank you, Katie.
Anytime.
And hopefully we'll see everybody next month. Thanks, you guys.
Thank you.